Hi, my name is Lucia. I'm a student nurse. I'm here to do a physical assessment on you, if that's okay by you.
It's fine.
Okay, so I wash my hands, I provide privacy and identify my patient. Can you state your name for me, please?
My name is Verlin.
Okay, and your date of birth?
10/12/93.
Alright, just making sure it matches with my mouth and that I have the right patient. So I'm going to be touching you and use my stethoscope on you. It's going to take a period of time. Do you feel like using the restroom or you want me to come later?
No, it's fine.
Okay, have you had anything to eat in the last 30 minutes?
No.
Alright, so that's fine. Okay, so I'll take my client's temperature, an oral temperature. So I'll put my probe in her mouth, under her tongue, and I'll record the finding. The normal finding should be 96.5 to 99.7. I would take the pulse, the radial pulse. Normal finding should be 60 to 100. And while putting my hand on the radial pulse, then I'll read my patient's respiration. I'll monitor the rise and fall of her chest while she breathes, and the normal for a complete 1 minute. And the normal finding has to be 12 to 20 breaths per minute. I'm going to use my cuff. I'm going to take your heart, your blood pressure. Okay. So I make sure that my client's feet are straight. My client's feet are flat on the floor, and that her right hand is beneath, on the same level with her heart. And I'll suspend her hand like this, or I'll use a table and suspend the hand so that it will be on the same level with her heart. And I'll do the two-step method. I'll locate her brachial pulse. And when I get the pulse, I'll tie my cuff 2.5 inch above the brachial pulse. And I'll make sure that it's not very tight. So in order for me to know it's not very tight, I'll use my 2 fingers, and if it comfortably fits in, then it's not very tight. Well, I'm sorry, you just have to put your hands like this, but I'm going to make sure that her hands are not suspended. So I'm going to pump the cuff, make sure that it's deflated, and I pump it. And when I stop hearing the pulsation, which I have stopped hearing at 120, I'm going to add 20 or 30 to it and deflate. Allow all the air to come out, and I'll wait for 15 to 20 minutes. Then I'll inflate again. And this time I'm going to use my stethoscope. Her blood pressure is 120 on 80. You're doing okay? Ma'am, are you in any pain?
No.
Okay. My client does not have any pain.
Said she was in pain. I would have rated the pain, the intensity of the pain on a scale of 0 to 10, when the pain started, how it feels, and what makes the pain to subside, and would have recorded my findings.
Listen to your heart rate. Without exposing my client, I'm going to inspect the chest. I'll monitor for the rise and fall of the chest and the muscles she's using in breathing. And I'll listen to her lung sound in all the lobes, in the 2 lobes. I'll start with the first. Take a deep breath in, out, in, out, in, out, in. And I'll listen to all the pulse, and I'll go to the back. I'll expose the back, inspect the back, and listen to the lung sound at the back. Take a deep breath in, out, in, out, in, out, A. Going to listen to your heart sound, okay? So I'm going to listen to the heart sound in all the five important points: the aortic, the pulmonary, the AF point, the apical pulse. I'll listen to the apical pulse, and I'll listen to the mitral sound and the tricuspid sound, and I'll take note of any irregularity. I'll take note of the reading S1, S2. I'll listen to the extra heart sound and any murmurs. Proceed with the physical assessment. I'm going to use my hands on you, and I'll be touching your body. So I'll start with the head. I'll inspect the head for even distribution of hair. I'll palpate for any swelling, any mass, any indentation. Ma'am, have you ever had a migraine, or have you ever had an accident with your hair?
No.
Oh, okay. I'll inspect the face. I'll inspect the face for symmetry. I look at the eyes, the nose, the mouth, the eyebrows. I'll look at the skin color, making sure that if there is any lesion, there is any bruises, and if there is any mole which is irregular, I'm going to take note. I'll palpate for any swelling. I'll palpate the lymph nodes as well, since I'm already in the head. I'll palpate for the lymph nodes. The lymph nodes, they are palpable and movable. Okay, I will inspect the ear for any drainage, symmetry, mass. I'll palpate behind the ears. I'll use my pen light, put on my gloves, use my pen light, and I'll look into my client's nose for patency and alignment. I'll ask my client to open her mouth. Open your mouth. I'll point my pen light inside. Say, ah. The gut reflex is positive. I'll look at the teeth, and if there is any teeth which has been removed, I'll take note of it. I'll look at the tongue. I'll look at the buccal mucosa. It should be moist and pink. The tongue, I'll look at the tongue for any wound and any abnormality. I'll inspect my client's neck, and I'll stand behind, ask her to put her head forward while I palpate the thyroid. It should not be palpable. Normal thyroid is not palpable. I'll palpate for the tympanic pulse, which is portable. It's nice and bounded. I'll palpate for the carotid pulse, one at a time, one carotid pulse at a time. It's palpable. I'm taking note of the reading. Ma'am, can you yes, turn your leg or put it down. Then you touch your ears with your shoulder. Can you do that? Your ear with your shoulder. Okay, and the other side. Yeah, her neck is flexible. That's I'm checking for range of motion. Can you blush your cheek for me? Can you smile? Can you do like this? Okay, I'm checking the cranial nerves, nerve 5 and nerve 7. So I'll inspect my client's body, inspect the body. I'm looking at the skin color. I'm looking for any bruises, lesion, mole, any abnormality. Can you? I don't see any. I'm also palpating for warmth, the temperature, which seems to be regular. The skin is dry and warm. I'll check for capillary. I'll check her nail bed. I'll check for capillary refill, which is less than 2. And I'll do same for the other hand. Check for capillary refill. I'm checking for strength. Ma'am, push my hands. Hard. Good. You are so strong. All right, ma'am. So I'm going to, can you just lean to the back while I listen to your bowel sound, okay? So I'm going to expose just the abdomen of my client, and I'll listen to the bowel sound. But before listening to the bowel sound, I'll inspect the abdomen for any pulsation. I'll look at the umbilical. Is there any drainage? Is it aligned? Is it midline? I'm going to listen to the bowel sound in all the 4 quadrants. I'll begin from the lower left quadrant, yes, to the right. I'll listen for the sound, bowel movement. I mean the sound of the abdomen, of the stomach, and if there is an abs, if I don't get any sound, then I'm going to listen to all the 4 quadrants for 5 whole minutes. Mom, when last did you have your last bowel movement?
Yesterday.
Was it regular?
Yeah.
And how do you pee? You pee okay?
Yeah.
All right. Are you sexually active?
Yeah.
All right. Do you use protection?
Mm-hmm.
All right. Just to be sure, do you have any disease down there?
No.
Okay. All right. So I'll continue to. I'll palpate for the femoral pulses bilaterally. I'm looking for the rhythm if it's bounding. I'm going to inspect the leg for color. I'll inspect the leg for color and symmetry. I'll palpate for warmth and dryness, and I'll do so bilaterally. Ma'am, do you want to lie down just a little bit so that I could? Yes, please. Thank you. Okay, I'm going to inspect the legs for color and symmetry, and I'll palpate for warmth.
You gonna pull up on it? Yeah.
I'll check the
Just a little bit.
posterior tibia pulses bilaterally,
Don't cry, Oscar.
and I'm checking for if it's bounding. I'll check the petal pulses bilaterally. I'll as well check for edema.
Also tomorrow, when I bring some
There is no edema. I'll check for capillary refill. Ma'am, do you want to push my feet? Yeah, so that's very strong. Do you feel anything
No.
in your calf? I'll check for range of motion. Okay. Then I'll ask my client to tend to the back, and I'll inspect the skin. I'll inspect the skin, especially the coccyx area where it's possible for her to have skin breakdown. Alright, after that I'll record my findings. If there was any abnormality, I'm going to notify the doctor. I'll wash my hands, come back to my client. Alright, man, thanks very much for your cooperation.
Thank
Okay,
you so much.
is there something you want me to do for you?
No.
Okay, so here's the call light. If you feel any discomfort, you can always ring it and someone will come to the nursing station, okay?
Okay.
I'm going to lower the bed to a comfortable position so that my client does not fall. I'll give my client maybe a glass of water if she wants. I'll wash my